Worker health is a complex and multifaceted aspect of occupational health studies. Understanding the components and factors contributing to worker health is essential for employers, employees, and policymakers alike. This narrative will delve into the significant dimensions of worker health and the impacts of work on physical and mental well-being. Firstly, the physical components of worker health include ergonomic considerations, occupational hazards, and the availability of adequate health services. Ergonomics, which involves designing the workplace environment and tasks to fit the worker, plays a crucial role in preventing musculoskeletal disorders and promoting long-term physical well-being. Efficient workspaces that minimize strain and repetitive motion are key in safeguarding a worker's physical health. Occupational hazards, on the other hand, vary significantly across different industries and can range from exposure to toxic substances to the risk of manual handling injuries. Employers are tasked with identifying these hazards and implementing appropriate measures to mitigate risks, such as safety training programs and protective equipment. Healthcare services available to workers also contribute immensely to their overall health. Regular health checkups and access to medical facilities ensure early detection and treatment of work-related health issues, thus serving as a cornerstone for maintaining worker welfare. Mental health, often overshadowed by its physical counterpart, is increasingly recognized as vital in the realm of worker health. The influence of workplace stressors, such as high workloads or lack of job security, can lead to issues like burnout and depression if not adequately addressed. Creating a supportive work environment where employees feel valued and heard is fundamental to nurturing mental well-being. Furthermore, the COVID-19 pandemic has shed light on the importance of mental health support, as isolation and remote work have altered traditional work dynamics. In conclusion, worker health encompasses both physical and mental dimensions, each influenced by myriad factors within the workplace environment. Ensuring a balanced approach, which includes addressing ergonomic needs, mitigating occupational hazards, and fostering a supportive mental health culture, is essential for enhancing worker health. Employers, with the aid of policymakers, should prioritize these aspects to cultivate a productive and healthy workforce. As societal understanding of worker health continues to evolve, it paves the way for innovative strategies that accommodate the changing needs of workers. This is part of my EHS topic in my Basic Plan Operator course. Please keep watching Shoaib Views channel for more informative videos. Please like, share, and follow my channel. Also press bell icon.